So today we're going to be talking about mallet finger splinting. When you splint the mallet finger, you splint the DIP only, the PIP is left free. The DIP joint position is 0 degrees extension to slight hyperextension. Research suggests only slight hyperextension because the skin over the dorsum of the DIP joint can be compromised and leave a pressure sore. So if you have a physician who likes a lot of hyperextension, that's okay. Just keep check on your patient, the skin on the back of that dorsum of the DIP. Out of all the types of splints there are for making mallets, there's no research to indicate that one is better than another. The number one success outcome indicator for success in the mallet finger is compliance with the splints. So there are different types of splints to choose from. You want to make sure the patient is comfortable because the biggest outcome for success is compliance with the splinting. This is a dorsal gutter splint. When you make this, you want to make sure you go from the tip of the finger to about mid portion of the PIP joint. This gives you enough force so that when the PIP joint bends, there's going to be no bend or flexion at the DIP joint. Sometimes a dorsal gutter is quite uncomfortable if there's no padding on it. Especially if it's a bony mallet, the dorsum and the DIP joint can be quite sensitive. So you can use closed cell padding, because remember you want to protect the dorsum and the DIP joint because that's where you can develop a pressure sore. So you don't want open cell padding because it will soak up moisture and compromise the skin. So you want to use closed cell padding, and you make it just like you do without padding. Usually with this type of splint with the padding, the patient's quite comfortable and they can make it the whole 8 to 12 weeks. You can do a volar type of splint, give them a volar option. Usually I do these when the dorsum of the DIP joint is so sensitive that they can't tolerate even the padded portion of a dorsal gutter. The only problem with the volar option is when you bend the PIP joint, it restricts your motion. It typically will be uncomfortable, usually at that digital crease, because it kind of sticks the patient as they bend into flexion at the PIP joint. So when I make these, I only make them for about a week or two until they can tolerate a dorsal gutter. Another type of splint you can use for your patient, especially for those who need sensation at the tip of the finger, is this splint. Doesn't require straps. It leaves the tip of the finger free for typing or other types of activities that need sensation at the tip of the finger. The only problem with this splint is that it restricts the PIP motion because it has a volar component. So as you're deciding which type of splint to put on your patient for their mallet finger, keep in mind that compliance with the wearing schedule is the biggest indicator for success. So you want to make sure whatever you use, the patient is quite comfortable and they're able to still do their activities that they need to do.